Thank you, President D'Annunzio and trustees. Let me begin tonight's Return to Campus presentation by thanking our teachers, support staff, and administrators for all their efforts in providing the best distance learning program we can for our students and our families. We're grateful to have Deputy Health Officer Dr. Mary Ann Limbos from the Yolo County Department of Public Health with us this evening. And we'll hear more about COVID-19 in Yolo County from her. I want to underscore the incredibly serious nature of this situation and how critical a moment this is for our district and our community. We're moving cautiously and deliberately as we consider how we will return to campus and to in-person learning, with the health and safety of our students and staff as our primary focus. I'm especially appreciative of the thorough attention that the Board of Education and staff are giving to the important considerations during this time. Our approach remains methodical and guided by data, open communication, and partnerships. What we have learned is that the landscape continues to evolve, and we do not possess the degree of certainty and predictability that we would like. As such, our goal is to make sure our staff and community stay informed about our approach and our considerations. What we can say with certainty is that we are continually evaluating our ability to move to a phase 3 hybrid in-person model, and we're remaining in close contact with our Yolo County public health partners. We'll hear in just a bit about how monthly, weekly, and even daily changes to COVID-related health data can have profound impacts on our planning. I'll also underscore there are no perfect solutions, but we will find the best local solution for DJUSD at this time. That's the work in front of us. It's real, and we realize it's not about creating what we desire, but executing what is safe and within our control to do. And as you'll hear tonight, we're continuing to take a measured, phased approach to the gradual return to campus. And this work must be accomplished through consensus. I want to acknowledge and express appreciation for the positive relationships and ongoing collaboration with our labor associations. These are challenging times, and maintaining strong partnerships is key to providing the best outcomes. In addition to working closely with our Yolo County Public Health Department, Yolo County Office of Education, City of Davis, and UC Davis, we're also developing a return to campus survey for families and staff, as well as student focus groups, to get the most current feedback from stakeholders on the immediate situation. This feedback, along with data from the county, will be important information to inform our work ahead. Next slide, please. We're thinking purposefully and strategically about the task ahead. Our actions have been rooted in our values, specifically in the 6 principles that continue to guide our decision-making process and our work. These are the principles of equity, recognizing and assessing individual student needs and providing the right resources to meet goals. Access, providing equitable opportunities for students to take full advantage of education offerings and closing the digital divide. Innovation, taking risks, exploring multiple possibilities, challenging the status quo, and seeking to continually improve processes and outcomes. Continuity, focusing on the progression of learning even while our campuses are closed. And compatibility, ensuring that learning and the integrity of systems can be maintained even if the model for instruction transitions in our phased return to campus approach. And lastly, efficacy, designing measures for our desired outcomes for teaching and learning. These 6 principles have proven successful, both in our forming our work in the spring and especially over the summer and fall as we created the new distance learning program. And they'll continue to guide us as we prepare steps for the next phases in our return to campus plan. You'll hear more tonight about that plan. DJUSD has begun our initial implementation of phase 2 of our return to campus plan to safely bring students with the most urgent needs to campus first. At the same time, we're carefully monitoring the county COVID-19 rates and developing plans for phase 3, a hybrid model that will include on and off campus instruction for all students. We'll continue to evaluate our ability to move to phase 3 in close consultation with our Yolo County health partners. Again, the work in front of us is real, and we realize it is not about creating what we desire, but executing what is safe what is within our control and possible for us to do. Next slide, please. And let me turn the presentation over to Associate Superintendent of Student Support Services, Laura Juanitez.
Dr. Bose, did you want me to go before?
Oh, I'm sorry.
Dr. Bose?
Yeah, I'm sorry. Let me instead, after welcoming Laura, introduce Dr. Marianne Lembos. She's been with us before, representing Yolo County Public Health, and we are glad to welcome her back to Davis Joint Unified this evening. Let's ask Dr. Lembos to take it from here.
Good evening, and thank you, Superintendent Bose, and good evening, trustees and Davis School community. Since I last spoke with you, the state has changed to a new tier system to monitor COVID transmission. County has moved from the most restrictive purple tier to the red tier on September 29th, and this week, having been on the red tier for 14 days, schools are allowed to reopen in our county. All schools that reopen are required to comply with the California Department of Public Health school guidance, which details safety measures that must be in place to keep students and teachers safe. Subsequent movements to the less restrictive tiers of orange and then yellow do not include any changes specific to schools. Additionally, if we move back to the more restrictive purple tier because of increasing case rates and or test positivity, schools that have opened will not have to close again. However, for schools that haven't opened, if we move back to the purple tier, those schools will not be allowed to open until we're back on the red tier for another 14 days. Based on our current case rates and our new outbreak in one of our skilled nursing facilities, I, at this moment, am doubtful that our county will be moving into the orange tier this month. And there is a possibility that we may even move back into the purple tier in the coming weeks. As you know, 9 schools in our district were granted waivers, which allowed them to reopen before this week. And 7 of these schools opened prior to this week, with the earliest school reopening on the week after Labor Day. I'm happy to report that to date, we haven't identified any clusters of cases or outbreaks in any of the schools that have reopened. I realize that it's only about a month of data and we have cold and flu season before us, but so far schools are following the safety protocols detailed in their reopening plans. So I think I will pause here and take some questions from the trustees if this is the appropriate time, because I know you may have questions about our safety protocols in the classroom and procedures for safe reopening.
Great. Thank you, Dr. Lembos. Yeah, we will appreciate the opportunity to ask questions. So I'll start with Trustee Adams and then Trustee Fernandez, and Trustee Papagay is not here this evening, but has given us a few prepared questions as well. Sure. So Trustee Adams, maybe I could start with you for any questions for Dr. Lembos.
Actually, maybe can I suggest we hear Dr. Lembos' response to Trustee Papagay's questions, because his are really well-founded in the literature and the studies of this. I think it might be helpful.
Okay, absolutely. So the first question, Dr. Lembos, is what is your current understanding in regard to transmission of COVID-19 virus from children to others? Anything you can update on this? Obviously, we're all reading in the literature, but it'd be great to hear from you.
Sure. Our knowledge about children and COVID continues to expand. And the evidence does seem to be clear on a couple of things. Number one, children seem to acquire infection less than adults. And number two, when they are infected, they are more likely to be asymptomatic or have mild symptoms. So studies continue to look at the transmission question. It's really one of the key questions as schools, poised to reopen. And for now, there still seem to be conflicting results. At your summer board meeting, we discussed the South Korean study that showed that children less than 10 years old seem to transmit infection far less than older children and adolescents. And this helped to inform CDPH's rationale to allow schools to bring elementary school grades back to in-person instruction through the waiver process, while keeping middle and high school grades in distance learning. So after that study, we have some conflicting studies from Europe that show low transmission rates in the school setting. And one of the recent ones is from Germany that was published just last month in September. And what was done in the German study is they looked at children who were lab-confirmed cases and looked at the amount of time that they'd been in school. And they included only those children who had been in school for at least a day during their infectious period. So of those 137 kids, they found that only 6 of them infected an additional 11 students. And the number of students that were infected ranged from 1 to 3 students per case. And they also showed there were also a couple of teachers who infected an additional 4 students. What's important to note in this study is that face coverings were not required in all the grades, and physical distancing was also inconsistent, particularly in primary school. So that kind of conflicts with what we heard in the Korean study. And in terms of U.S. studies, again, we have some conflicting results. There was a study published in Pediatrics in August about childcare. So these would be younger children. And this was a study done on childcare workers who had remained at work during the time when, most of the rest of the country was sheltering in place. And they found very few cases of transmission in these childcare workers. Then, so again, contrary to that, there was a study published about an overnight camp in Georgia. This took place, some of you may have heard about it, in June 2020. And there were 597 campers at this camp, ranging in age between 6 and 19 years old. And they showed a high attack rate in all the age groups. But again, face coverings weren't universal among the campers. There were large cohorts sleeping in the same cabin. And there, as you see in camp, there was a lot of activity that would expose campers and the staff to exhale droplets, such as, a lot of singing, a lot of vigorous cheering, like you see in camps. So really my answer to your question is that, or to Dr. Poppingay's question, is that we're still gathering data. We know children can transmit infection. How easily they do still remains to be answered, especially if you factor in all the safety measures that we're recommending. So I think what the U.S. right now is doing is gathering baseline data so we can start answering the question using data from U.S. schools. So a very large study was published in the MMWR 2 weeks ago that provides baseline data on COVID infection in U.S. school children at the start of September. And it describes the trends of infections from March, when we had widespread school closures, follows those trends through summer, and then again to the beginning of September, which marked the start of school in some parts of the country. And that study, again, showed that older children and adolescents had double the incidence of disease compared to younger children 5 to 11 years old. And as the school year progresses, the U.S. can follow that incidence and can also factor in the effect of on disease trends, the effect of our preventive measures and our disease trends. So we also have baseline data in Yolo County. To date, children 0 to 17 years old make up about 11% of our cases, which is similar to what's reported for the U.S. overall. I think the U.S. is reporting about 10.7% of cases are among children in that age group. And for Davis residents specifically, Davis children make up about only 5% of the cases that we've seen in Davis. This may partly be a reflection of who's getting tested in Davis, but it'll really be important to monitor these numbers as schools slowly start to bring kids back to the classroom.
Thank you very much for that, Dr. Limbos. So Dr. Papague's second question is about what the county's current recommendation is in regard to testing asymptomatic contacts of positive contacts, whether it's students, teachers, staff, or whomever. So,
right.
What's the view of testing asymptomatic contacts of folks that have a positive test?
Okay. So we recommend that all close contacts of a positive case be quarantined and tested. So as of today, our county has sufficient testing capability to be able to offer this testing to close contacts if they're not being tested through their primary care provider. And this applies even for children, because I know that some of our local health providers aren't testing asymptomatic children. So our county testing sites will test asymptomatic children. Mm-hmm. If a close contact doesn't get tested for whatever reason, they still need to quarantine for the 14 days. And also, if a close contact gets tested and tests negative, they also still need to quarantine for 14 days.
Okay. Thank you for that. So Dr. Papague's next question is around just the university, UC Davis has gone to, I think, what can be described as surveillance testing of their students.
Right.
That does seem to be different than, what the county is recommending. As you think about what the university is doing and how we think about what the schools here in Yolo County are doing, can you talk a little bit about that? I mean, is
Sure.
surveillance testing something we should be considering?
What the university is doing is they are, like you're saying, they're doing, we can call it surveillance or screening testing of all their students who live on campus and their staff. And really, they are recommending that testing be done, not recommending, they are requiring testing be done weekly, and they're hoping to ramp it up to twice weekly. And this is an appropriate testing, a screening program, because it will effectively, this frequent testing will effectively identify infection and allow them to limit transmission and hopefully prevent a widespread outbreak. So it needs to be, in order to do that, you need to screen people regularly, frequently. So the reason that we've made the statement that we're not recommending the surveillance testing as a CDPH schools guidance is because CDPH is recommending that testing be done every 2 months. And one of the suggestions in the guidance is screening 25% of school employees every 2 weeks. We really don't believe that is an effective way to infection and to limit spread on a campus. It's not frequent enough. And really that's why we made the statement that we are not recommending that screening testing of school employees as put forth by CDPH. There is some discussion at the state level that there will be an update to that guidance because in discussions with health officers, I believe the state is realizing that too it's not frequent enough to effectively detect infections quickly. And really, may just provide a false sense of security to school employees. I tested negative October 1st. I'm going to be tested again in a couple of months. But it really is, we feel at the county, it's not an effective way. It really won't be a way to keep students and teachers safe if you're testing that infrequently.
Mm-hmm. So do you think we're going to come to a place, I know you don't necessarily set policy, but where, something that feels more like the weekly surveillance testing that UCD is doing is something that will be considered for schools in California in our county, in Yolo County?
I think if you are going to have an effective screening program, it has to be that frequent. Honestly, I don't know how realistic that is for K through 12 schools because it involves a lot of, it's complicated logistics. Which test are you going to use? How are you going to accomplish the testing, who's monitoring the samples, and it's resource intensive. So I think that's why I say that is I don't know how realistic that type of screening would be for our K through 12 schools.
Okay, it's a little troubling because I understand the point about resource intensive, but at the end of the day, if we're going to open up safely, I understand your point about every other month being. It seemed like that's not realistic to provide any kind of meaningful data, and so I think it's a challenge for our state to figure out how we get to a place where we can have the kind of testing we need, where we do feel comfortable. It will be interesting to see how the university program works. Certainly, obviously, the chancellor and the staff are working very hard on it for our university students. If there are lessons to be learned, I hope we're able to incorporate those for our K-12 students, both at the state level and the county level. And I don't want you to feel like we're being grilled here, Dr. Limbos. I understand we appreciate you coming, and I want to be a good colleague, but obviously this is extraordinarily important to us in our mission. So just a couple more questions.
Oh, absolutely. Yeah.
From Trustee Popengay. So as you think about it, what additional testing do you think you need to have to be able to to sort of manage this process? Are we close where if we needed to implement something like this, we could do it, or are we way away from having the amount of tests available and testing processing to be able to manage it? Because the university has, obviously ramped up a whole process. Are we at a place where something like that could even happen, for us at the K-12 level in our county?
I think that would be something that we could discuss with the university, and like you said, kind of lessons learned from them and how they're implementing their procedure. I think, like you're saying, I think if we're going to be doing screening, which as we return to in-person instruction, it needs to be meaningful screening where you're going to make a difference in disease transmission. So how to do that practically and in a way that can be managed in the K through 12 setting, I think the state is considering. I think places like UCD that are doing it on a mass scale will be really important partners in this, because like you're saying, they may be able to provide us some information about, like you're saying, best practices. What the county can do right now is be a partner with the schools in terms of response testing. So what I mean by that is if a positive case is identified in a school, we will certainly be able to help with providing testing that will give, a rapid turnaround time, and we can also partner with the schools in terms of, isolating and quarantining those people that need to be. So right now, the county has the capacity to at least help schools with the response testing if there are positives on campus or in a district office.
Okay, thank you. And then last question, you sort of alluded to this in your statement, but there's a belief with winter coming, flu season, inevitable second wave of COVID-19 infections, or I don't know, maybe it's the third wave now, depending on how you look at it. Yeah. Any thoughts about that, how severe it is, what we're doing to try to prepare for that?
Yeah, well, and we're definitely preparing for it at the county level. And really, one of the most important things that we're doing right now is emphasizing the importance of flu vaccination. It's important in every season, but this season coming up more than ever, trying to decrease the chances of that twindemic that people are bracing for. So our vaccine clinics are well underway, and we're really trying to get the word out that those who can be vaccinated should be vaccinated for the flu. I mentioned that we have a lot of testing capacity right now, and we want to make sure that that continues to be one of our commitments to keeping our free county testing sites available to our residents throughout, late fall and through the winter. We have our free state testing site available to us through November, and we're in discussions with the state about what will replace that after November. And we're also receiving an allocation of rapid antigen tests from the federal government, and we'll be strategizing about how best to deploy these to our community partners. So we're working on those strategies right now. One of the things that we've worked on throughout the beginning of, from the beginning of the pandemic, is really trying to develop a robust case investigation and contact tracing program. And we have tried to involve our school staff in that. So, we've provided information to the districts about getting nurses and other school staff who are interested in the free training for contact tracing that's available through the state. And we just received news this week, actually, that the state has developed a school-specific module for that contact tracing program. So that's going to be rolled out at the end of the month. And then really not just specific to, the school community, but just to our Yolo County community, what we're seeing in terms of how, in terms of our cases and how they're getting infected is small family gatherings, or not just even family gatherings, just gatherings. And so we're issuing guidance because we know that they're happening on how to do those gatherings safely. especially with the holidays and all the opportunities coming up where people will want to gather with their family and friends. We want them to do it safely. So incorporate face masking, physically distancing, limit the crowds, do it outdoors if possible. Because we talked about, in March about flattening the curve with our really strict stay-at-home measures. And, as we prepare for this second wave, I think we need to do that again with these mitigation measures.
Great, thank you, Dr. Limbos. So now I'll turn it back over to my colleagues and for their comments. So we'll go back to you, Trustee Adams.
Well, first of all, thank you for your patience with all the questions, and those were really good questions by Trustee Popengay. But one question I'm left with is there a timeline for when the state will make a decision about issuing new guidance on testing, including response testing and surveillance testing? And
the short answer is no. They have not indicated when they will issue new guidance, but the fact that they're already talking about it, I don't think it will be too far off in the future. Those of us who are in the tiers that our schools are reopening have really been making it clear that we need to have more guidance particularly for the screening / surveillance testing, because that is going to be important information for schools as they plan their reopening. I don't think they will be issuing any guidance in terms of the response testing. I think that will be up to individual counties. And like I mentioned, our county is committed and prepared to support our schools getting access to testing in response to positive cases on campus.
Okay. One thing that the county has talked about, and you mentioned in your last question, is social gatherings. It's been a large source of spreading. Yeah. At the same time, when I saw the announcement, you can have 3 families gather together, right? Or
3 households, yeah.
Yeah, 3 households. Yeah, thank you for the correction. How can that really work, and how is that? To me, it's counterintuitive to earlier messages you have given us. How can that really work and help flatten the curve?
We know it's happening, so that's I think it would be difficult to say don't do it when we already know that it's happening. I think the more effective message is we know that this is happening. This is how to do it safely. So that's what I mean by mitigating, by harm reduction. We already know that it's happening. So if you are going to participate in these gatherings, this is what should be, a part of that. The face coverings, the physical distancing, outdoors if possible, keep it short. One of the things that the state didn't include in the gathering guidance is that a cap on the number of people, because we know that 3 households can mean different things to different people, and there can be very large numbers of people in what some may consider one household. So, our county thinks that may be a really important omission on the state's part, and we are considering issuing guidance, if not something stronger, that may put a number limit on on these gatherings.
Okay. And then my final question is, you talked about schools that had gotten waivers.
Yes.
And it's been, the lesson that I have picked up on in containing the virus is testing, tracing, and isolation. So what are those schools doing that's so unique in that situation? And how is it that they're able to get a waiver? And why isn't it? And, just what unique features is really what I'm getting at in terms of the waiver schools. What do they have that allow them to get that?
The waiver schools developed a reopening plan that was consistent with what was required by CDPH for a safe school reopening. And it really is they're the same measures that are included in the YCOE reopening task force document that most of our school districts, if not all of our school districts, participated in. And it really follows the CDPH schools guidance. So, the face coverings, the disinfection, the cohorting. So I don't know if there's anything unique that they put in their reopening plans that weren't included in the school's guidance. The contact tracing and case identification, as well as the testing, are in line with the protocols we developed with all the schools earlier in the summer. I know Davis Joint Unified participated in the development of those school response protocols, and they're widely distributed. So those are the same protocols that the waiver schools are using. I think only one of the schools is actually doing the screening testing of teachers and students that we've been discussing.
Okay. All right. Thank you.
Oh, thank you, Trustee Adams. Trustee Fernandez, questions for Dr. Limbos?
Well, first, thank you for being here, and you've provided a lot of information, and also thanks to my colleague who's not here, who asked some great questions, as we know he would. I think you're hearing it overall sort of, well, maybe you're not hearing it, but I think there's some frustration about testing overall. I mean, I think, we're months into this pandemic, and I think testing has been identified as, a constant impediment and obstacle for us to really get our hands around this. And so it is somewhat disappointing to hear, that even CDPH's guidance is having to be pulled back. And so I don't know what to say specifically about that, other than, we talked about what UC Davis is doing. What are the guidelines that you guys have for school reopening say exactly about testing? Because you just mentioned sort of the schools in the county that are going back. What testing are they doing exactly, if any? And what are the guidelines saying about testing, our local guidelines?
Our local guidelines pretty much follow the CDPH school guidelines, except for the fact that we aren't pushing for that the surveillance testing that they've recommended. The testing of symptomatic people, the testing of close contacts, those are all in line with the current CDPH and, for that matter, CDC guidelines.
And the the schools in the county that are opening, what are they doing exactly as it relates to testing?
You mean for screening or?
Well, like for example, St. James is now on, that is a school in the district. It is open now. And so what testing protocols are they doing, if any?
They are not doing any screening. All the testing for all the schools that were granted waivers is, again, what I have been referring to as response testing. So if there is a symptomatic person or there is a close contact, then the protocols that have been, or the reopening plans that have been submitted will refer the symptomatic person and the close contacts to their primary care provider. And if the primary care provider doesn't do the testing, then they are referred to a county testing site.
Okay, switching gears from testing, I guess, and maybe just my last question is, how is the flu vaccination distribution effort happening in the county?
That has been that's been coordinated by our emergency preparedness division. All the county flu clinics have already been scheduled, and we have tried to schedule the flu clinics in each of our major cities, and have stood up a few of them on actual school campuses. So we have one coming up this Saturday at Harper Junior High.
Right.
Yeah.
So no, I'm more asking, how's that going? That's the general question. Is like,
okay.
how is that going? Yeah.
It's being very well received. Last week, we used all of our injectable flu vaccine. Unfortunately, we had to close the clinic a little bit early because we went through our entire supply. And we were worried that we were going to have to cancel this coming Saturday's clinic if we weren't able to get more vaccine. But the state was able to procure more vaccine for us in the tune of, I think, up 500 doses. So we are going to be able to follow through with this Saturday's clinic. The reason we ran out of vaccine is there have been some delays in terms of shipment from our distributor, but those are starting to come in. So we have a pretty full schedule of clinics coming up in the next few weeks.
Okay, great. Yeah, no, I mean, the reason I asked that is because I know one of the things that was talked about is just how do we manage from a regional, local perspective, the distribution of vaccine. And we, if I recall, we were using, or maybe not using, but we were paying particular note of the distribution of the flu vaccine during this season for purposes of learning, what issues we may need to address and things to learn to the extent that there ultimately ever is someday a vaccine for COVID. So.
Yeah, and that's exactly what we're doing. The COVID vaccine has, depending on which one we get or which ones, we don't know if we're going to be offered more than one type of vaccine. But there are just some tricky things related to storage and perhaps ultra cold storage, and we're also waiting for the CDC to provide us with the priority populations that will be on, I guess, that tier 1 for receiving the vaccine. But the kind of the standing up of the flu vaccine, the whole ordering process really has been a good preparation for the preparations for COVID vaccine.
Great, thanks.
Sure.
Thank you, Trustee Fernandez. And again, thank you, Dr. Limbos, for your time. I already blended a couple of my questions with Trustee Poppengaze, but I have just a couple others, and then I'd like to ask our student liaisons if they have questions for you as well. So as we, just on the topic of vaccine, and I know we none of us know when it'll be available, but to be clear, obviously as a school district, our first focus is for the health and safety of our children, our teachers and our staff. It's, my understanding that, that the vaccine work to date has really focused on adult vaccines, and often vaccines for children can be trickier for a variety of physiological and and other reasons. So can you comment all on sort of, as that rolls out, the likelihood of an initial vaccine also being available for for our students?
Yeah, I think the pediatric vaccines will probably be released later. And the reason I'm saying that is we just got word from Pfizer that they are going to be including children in their clinical trials. So that's only one of the vaccine manufacturers have actually included children, and they are starting with actually older children and teens. So the ages they're including are 12 and over. So yeah, I think I think the road to a pediatric vaccine will likely be a little longer because of that. Like you're saying, that there are special considerations in children, and there's also some kind of evidence that's coming out that children have a different immune response to COVID. So I think all of that will probably have to be considered in when they're including children in these clinical trials and seeing their responses to potential vaccines.
Okay, thank you for that. And then my last question goes back to something you mentioned earlier. We talked a little bit about, sort of winter's coming. We've all been worried about all the factors that we've talked about. And, some initial trends in the last week or so in our county, maybe headed in a challenging direction. Can you comment upon what are leading indicators for us as we try to grapple with, how to maintain the health and safety of our students, our teachers, and our staff? And, what things would suggest, I'm not being doom and gloom, but, what factors do you look at and you start going, oh boy, you should get worried about that things are heading in the wrong direction? Can you share a little bit of your thinking about that?
I think the move to the tier system has made things a little bit easier because we're now using only two metrics. Well, actually, I shouldn't say that. We're using three metrics. The two metrics that we focus on are the case rate per day and the testing positivity. I think those are really important things to look at, and just more than the day-to-day is really looking at the trend. That's one of the things that is actually good about this tier system, because we're looking at trends. The tiers are updated once a week. Yeah. So instead of kind of looking at the individual little blips that occur each day, we're able to look at trends. And that's really what we're following. One of I neglected to mention what was introduced last week, kind of as part of the tier system, is a health equity metric, which is a look at the testing positivity in the most disadvantaged zip codes in the county. So that testing positivity also has to meet the metric for the less restrictive tier in order for the county to advance to that tier. And really, it's to make sure that counties are directing resources to those geographic areas and to those populations that need the resources most, that are most affected by the infections.
Mm-hmm. Great. Thank you for sharing that. And so really it's, we need to continue to look at those two metrics, the case rate and the testing positivity as our leading indicators and the trends over not days, but a week or multiple weeks.
Right. And, I mentioned kind of briefly in the beginning that we do have an outbreak right now in one of our skilled nursing facilities. And those will certainly, those cases in that one facility will affect our case rate and testing positivity for at least a couple of weeks. So, our community, I shouldn't say we should separate those, because the way those infections get into our nursing facilities is because somebody brings them in. And so it's reflective of what's happening in our community.
So I sort of had a part B to this question, so I fibbed a little when I said I only had one question, but it was one question, but a part A and a part B. So the part B is then, how does, the university is largely in Yolo County, and they're obviously doing quite a few tests now as part of their surveillance testing. In theory, if they're getting low rates with lots of tests, doesn't that bring our positivity rate down, or are their tests included in the county numbers?
Yeah, you're right. If the number of tests that they're doing does affect our positivity rate, if there are a lot of negatives, it will bring our testing positivity down. Their
results are included in the results.
Okay. Yes, initially there were a couple of hiccups because the students were tested right when they arrived on campus, and they all didn't know their campus address. So they put their home address. So we had to do a lot of tracking down of tests that were sent to other counties. But I think, I think the system has smoothed out, and I think they are all putting their Yolo County address now. So they are going to be counted in our rates.
Okay. Thank you, Dr. Limbos. So now I want to turn to our student liaison. So I'll start with Ms. Ortega-Nunez. Do you have any questions for Dr. Limbos?
Yes, I do. Hi. I was wondering if the reason why middle schoolers and high schoolers are more likely to show stronger symptoms and develop and get COVID is because we're being less careful and being exposed more often to COVID, or because it's actually our immune system?
Yeah, it's probably something physiologic that is going on with students in those older age groups. In the studies, they almost have, reactions that are, or rates of infection that are really pretty similar to adults. So there's probably something in the way that older children and teens respond to the virus compared to how younger children in the elementary age groups respond.
Okay, thank you.
Thank you, Ms. Ortega-Nunez. Mr. Lee, questions for Dr. Limbos?
Yeah, I had one. So as far as I know, insurances are paying for COVID testing only as long as it's diagnostic. But if it's for screening, like how we're proposing, I don't think that insurance companies are required to cover the costs. So I know that Jesuit is facing similar problems of that nature right now, as they're trying to open up now. So who would be paying for the screening tests? I know they can get ridiculously expensive. Mm-hmm. I'm kind of worried that a lot of people wouldn't be able to pay for it. So is there some sort of funding mechanism set aside for testing my classmates, or will there be some sort of state funding that will be available?
Yeah, I think that is one of the important questions schools and other people who want to do this type of screening testing are grappling with. Because, yeah, you're right. Who is going to pay? I've talked about response testing that can be done through our county sites or through primary care providers. Insurance covers that type of testing. For people without insurance, if they get it done through our county site or through our state testing sites, it's free. But yeah, the question is that screening and surveillance. I think, it's the answer right now for that is TBD. It's still being discussed and worked on by lots of people. Great question.
Great.
Thank you.
Any other questions, Mr. Lee?
That'll be it for me. Thank you.
Okay, great. Dr. Limbos, thank you again. First off, thank you for your service to our community, our county. We're really grateful, and thank you for your time in answering the questions this evening. It's very helpful for us as a deliberative body and helpful for the community that's listening to hear from you. So thank you.
Thank you. Happy to be here.
So Dr. Bose, I'm going to turn it back over to you.
Very good. And now let's ask Associate Superintendent of Student Support Services to take it from here. Go ahead, Laura. Thank you.
Great. Thank you, Dr. Bose and trustees and student representatives. Before I get started, I do want to give a plug to the flu clinic on Saturday. 10 of our district nurses will be actually giving the flu vaccines. And so we will all be out there from 10 to 2 on Saturday. So tell people to come.
And that's at Harper Junior High?
At Harper Junior High, it's drive-through, but we do have a bike lane. So if one wants to bike through,
Sweet.
You can do it that way. Yeah.
Awesome.
That'll be good. Yeah, I'll be there. So I want to begin by revisiting the framework for how we continue to make decisions related to serving students. As a district, we must pay close attention to the health in our community, as Dr. Limbos said, and work closely with the Yolo County Public Health Department regarding our plans to reopen. We must prepare our sites and provide ongoing health and safety training to staff and our families so that they feel comfortable returning to in-person instruction. Lastly, we must always keep in mind that we have some students who are not accessing their education through distance learning, and it is a priority that we bring them back onto campus for in-person instruction. On August 31st, Governor Newsom released the blueprint for a safer economy that tracks 2 metrics, the 7-day daily case rate and the 7-day testing positivity rate. Yolo County was first placed in the most restrictive purple tier, which indicated that the virus was widespread in the county with more than 7 cases on average per week per 100,000 residents, or more than 8% on average per week of positive test results. Counties must remain in the current tier for 3 consecutive weeks before they can move to the next less restrictive tier. And the county must meet the lower tier criteria for 2 consecutive weeks before moving to that tier. So on September 29th, Yolo County was able to move into the red tier. And on October 13th, we began the 3rd week in the red tier with new cases per day of 4.2 and testing positivity rate of 2.4. Although the test positivity rate is currently in the orange tier, the new cases per day increased to the red tier this week, which means that the earliest that Yolo County can move to the orange tier would be October 27th. If we move into the orange tier, we have to remain there for at least 3 weeks, and therefore the earliest we could move to the yellow tier would be November 17th. It's important to note that during the weekly assessment by the state, if a county's adjusted case rate or test positivity rate has fallen within a more restrictive tier for 2 consecutive weekly periods, the county must move back to that more restrictive tier. So Yolo County could move backwards into the purple as well as moving forward into the orange. So when looking at our data for October 13th, we had 19 new cases reported, and 4 of those were from Davis. The county's test positivity rate for September 29th through October 5th was 3.83%. And as you can see the graph on the right, the county has experienced a steady decline in new cases in September, but we are starting to see a small increase over the past week. So currently we are moving into phase 2 of our plan, which includes a partial return of students with urgent needs. This has required a close partnership with staff as we prepare our campuses for a return of students. This week, we began in-person special education assessments with a focus on those assessments that were the most overdue. We have increased the number of rooms to 20 spread across the 4 campuses. And to prepare for this week, Special Education Director Patrick McGrew, Deputy Superintendent Matt Best, and I have met with special education staff multiple times to answer questions and clarify procedures. In addition, District Nurse Amy Stacy and I held a Zoom training last Friday on the specific health and safety measures that will be followed during in-person assessments. We have over 30 staff currently conducting in-person assessments, with our plan being to reduce the backlog of overdue IEPs. We are currently working on step 2, which is the specifics to provide in-person services such as physical therapy, occupational therapy, speech and language therapy, and educationally related mental health services on campus. I want to clarify that many of the services will continue in a virtual format because they are working well and the student is benefiting from the service. Our focus will be on the students whose service needs cannot be met in the virtual format. This could be our youngest students who have difficulty accessing services remotely. It could be those students with a large number of specialized services or students whose disability makes online service delivery difficult. We are continuing to work with the individual providers to identify appropriate campus locations and to provide additional PPE as needed. Since these services are going to be provided at the same 4 sites where we are providing in-person special education assessments, there will be a nurse present to conduct wellness checks prior to the appointments. We are currently identifying the staff who are able to provide the services in person, and we will begin the scheduling process soon. We are also working with our special education transportation company to provide bus service for students when this is needed. Step 3 of phase 2 is the small cohort classes. And this requires identifying small groups of students who need more supports to better meet their educational and socio-emotional needs. Our initial plan is to continue to hold these at the 4 identified campuses, but we know that we'll need to evaluate whether additional schools will be needed. Staff are currently creating a metric that can be used to identify these cohorts. This can include students with an IEP or 504 plan, English learners, foster and homeless youth, and students who are doing poorly academically in distance learning. So 2 groups that are logical choices to bring back on campus are foster youth and students experiencing housing insecurity. It's important that we look at the specific circumstances of the students to determine if they require in-person education to access their learning. So for example, in DJUSD, we have 23 students in foster care, and we have 27 families facing housing insecurity, which represents 43 children. So we have from 1 to 5 students in every grade, and they are spread fairly evenly across all the campuses. To better understand these students' specific circumstances, we look at their attendance so far this year in distance learning. Of the 66 students who are either foster or homeless, we found that 49 missed less than 6 days. So this means that 74% of the students have shown that they can access distance learning most of the time. The flip side of this, of course, is that 1 out of 4 foster or homeless students are missing significant amounts of school during distance learning. So when our foster and homeless youth liaison, Samantha Webster, directly spoke to the families experiencing housing insecurity, she found that only 23% of the families actually wanted their child to begin in-person instruction. She also found that only 48% of the foster youth guardians wanted their child to return to in-person instruction. In both groups, The primary concern raised by these families was that distance learning was safer for the health and safety of the entire family. So when conducting these interviews, it becomes apparent that creating cohorts will require assessment of individual student needs in conjunction with the family's preference regarding whether it felt safe to return. For those willing to come back this fall, we would want to structure an educational experience that offers the students the supports that they cannot always get at home. This includes a stable internet, in-person tutoring, and immediate access to counseling and foster homeless liaison supports. So now I will turn this over to Director Ricardo Perez, who's going to discuss the needs of English learners.
Thank you, Associate Superintendent Laura Juanitas. Good evening, trustees, Superintendent Bowes, and members of the community. I want to highlight one very important point, and that is when considering how to address the needs of our English learners as we enter phase 2, in-person small cohort instruction, we have to take into consideration the individual and specific needs of every student. One thing that has become increasingly clear is the level of variability of how our students and families are being impacted by COVID-19 pandemic. We have households in which both parents have lost their jobs, others are being furloughed, many facing food insecurity, and we have some cases where secondary school age students have taken on a job to support the household. Other households where both parents are essential workers and an older sibling is having to take care of their younger siblings, all while trying to stay on top of their own learning. These are some, and there are many more cases that I can highlight that our staff have identified from late summer into fall through our case management approach. I'm proud to state that the staff across all sites and subject content areas have come together to collaborate and share resources, ideas, and best practices in order to make sure that our students are not only surviving, but thriving the best they can in this new environment of remote teaching and learning. Our EL specialists and paraprofessionals are providing individualized supports for our English learners in a small group setting with flexible grouping in order to make sure that they receive the care and the support they need during this difficult time. They are also reporting challenges and family needs to site and district support staff like counselors, homeless liaisons, crisis managers, and reading specialists, to highlight a few, in order to ensure that students can focus on learning. I also want to underscore an important breakthrough that our English learner staff have achieved to better support our students and families, and that is implementing remote testing. Identifying student language proficiency is a critical step in creating a wide program of support and individualizing learning, and our staff have been able to completely operationalize the initial English learner proficiency assessments for California into a remote testing platform. As we move forward in creating small in-person cohorts, these are some things that we are further learning about our students that we need to take into consideration. An area of challenge for our English learners are supports and secondary content area courses. It is more challenging in a distance learning for staff to scan the room than when in a physical room. They were able to check for understanding by walking around and surveying the physical room, read student facial expressions, and on the spot, provide feedback and support. In a distance learning environment, there are more challenges that do not always allow general education staff the opportunity to provide these individualized supports. In my conversations last week with both secondary and elementary English learner staff, we were able to get to a granular level on how we would prioritize small in-person cohorts for our English learners. EL staff, in fact, are able to prioritize by name students across the whole EL spectrum that can benefit from receiving in-person supports. Staff point out the importance of students maintaining their distance learning courses and for there to be staff in person to support them through the day and also provide in-person interventions in the afternoon. There's also discussion of the possibility of having tutoring supports that take place in person in the afternoon. While these are preliminary ideas and discussions, in the coming week, we will continue to ideate and further analyze and finalize details. Next slide, please. Another very important group within the English learner cohort that I want to further discuss are migrant students. I'm very proud of all the work that our staff have done in order to make sure that our students have all the necessary supports. The Davis Migrant Center currently houses 54 families with a total of 51 children. A total of 40 children are registered DJUSD K-12 students. Yolo County Housing manages the property, and in collaboration with Migrant Education Region 2, also provides a wide range of social and health services to families and students. Davis Joint Unified staff work closely with both Yolo County Housing and Migrant Education staff to support and meet the educational needs of all DJUSD students residing in the camp during the season beginning in April through the end of October. I have built strong relationships with the directors and staff from both Yolo County Housing and the Office of Migrant Education Region 2 program. With the surge of the COVID-19 pandemic, this close partnership and clear communication has become even more essential in ensuring that the students and families receive the best wraparound services available. In April 2020, when the Davis Migrant Center opened and families returned, DJUSD staff across many departments coordinated resources and information to allow for a successful return of students in a distance learning environment. Chromebooks and free Wi-Fi connectivity were issued to all students so that they could successfully engage in distance learning. My staff and I, along with the director from Yolo County Housing, also coordinated among the Mexican Consulate, the California's Governor Office of Emergency Services, and DJUSD nurses to bring additional resources to families, including literature on how to keep families safe from COVID-19, free medical services, and COVID-19 testing, if needed. Additionally, EO staff also coordinated a six-week distance learning summer program for migrant students. The summer program was designed to address academic and language skills that may have been lost due to the school closures and distance learning. At the start of this school year, more Chromebooks and Wi-Fi hotspots were issued so that students in a household would not have to share resources and could be assured that they had improved connectivity. Also, Yolo County Housing and Migrant Education coordinated small cohorts of 10 students in grades kinder through 5th grade to be supported by Migrant Education staff for students who could not be supervised at home if both parents were working outside the household. The students joined their distance learning classroom supported by DJUSD teachers, and Migrant Education staff help monitor the students throughout the day. In addition, we have coordinated staff from the district office, Margaret Montgomery, and Harper to be on call to support families in need of technical support or resources to access distance learning. This group of staff who support our most vulnerable families has, with the support of DJUSD Climate Coordinator Kate Snow, evolved into a formalized group that is known as the Spanish-Speaking Student and Family Partnership Team. This group is comprised of counselors, family liaisons, vice principals, directors, TOSAs, paraeducators, bridge coordinators at the elementary, junior high, and high school levels, as well as district prevention and wellness managers. The team prioritizes ways to improve the experience of all Spanish-speaking families and students during distance learning, especially migrant students and families. Staff members in this group meet every Friday to discuss support and share resources to better assist families in need. As we move into phase 2, migrant students are on our priority list for small in-person cohort supports. We know from the spring and early this fall that the rural and remote location of the Migrant Center poses challenges with internet stability. Providing individual hotspots for every student, more recently connecting more stable Wi-Fi connection in the K-5 daycare rooms have improved connectivity. What we know is that our secondary students need more support from in-person supports, as they are not in small groups like K-5 and are relying on the continued remote learning supports, but can in fact receive more supports through in-person tutoring and interventions provided by staff and support staff. One thing that I want to highlight is that many of our students are beginning to return to Mexico, and we have offered students and families the option to take Chromebooks and hotspots and continue with distance learning. One EL specialist has reported to me that 2 of our students and families are connected and are continuing with their education in Mexico. This is a huge breakthrough, since every year it breaks our hearts when students and families leave and their learning is interrupted and results in learning loss. I'd like to point out that the silver lining of distance learning is that this year, for families who opt to continue to stay connected, we have mitigated a huge issue which we refer to as the interrupted schooling phenomena. This in the past has negatively impacted student learning. As we reflect on the challenges facing us this year and beyond, our work is centered on finding ways to fulfill our commitment to promote equitable opportunities for all our students. This means careful assessment of needs and then prioritizing resources and services for our most vulnerable students and families, which include migrant students and English learners. Through the new and developing structures and practices, as well as community partnerships, we will continue to create a safe and supportive environment to enable all students to achieve their goals and aspirations. And now I would like to turn it back to Associate Superintendent Laura Juanitez.
Thank you. So there are a number of considerations when planning to bring students back with urgent needs to campus. First and foremost is that the cohort must provide stability for the student versus uprooting them from a class environment that, although it might be difficult for them, does provide a sense of familiarity and normalcy. One model we're developing is for students to remain in their distance learning classes in the morning with their current teacher and peers, and then later in the day, they would receive in-person academic support to manage the rigor of the course. Supports could be provided by counselors, tutors, paraeducators, and EL specialists. Students could be on campus all day or work from home in the morning and come to campus in the afternoon. What we're learning from our staff is that keeping students together by grade level is important, even if it means combining students across school sites. For example, we could have a 7th grade class at Harper Junior High that draws students from Holmes and Emerson as well. We might have an 8th grade class at Holmes and a 9th grade class at Emerson. We could have a class comprised of homeless, foster, EL, and students who are struggling with their courses. But the common denominator of each cohort would be that the students are struggling to access their education through distance learning. Lastly, and most importantly, we need to look to staff to identify the specific students who would most benefit from in-person learning at this time. And we need to work together with staff to create the model of learning that meets the specific needs of these students. And now I will turn this back to Dr. Bose.
Thank you, Laura. And let me note again briefly the 6 principles that have proven successful in informing our work in the spring and especially over the summer and fall for distance learning. They'll continue to guide us as we prepare steps for our next phases in our return to campus plan. Finally, tonight I want to thank Deputy Health Officer Dr. Marianne Limbos, Associate Superintendent Juanitez, and Director Perez for their contributions for tonight's work. Let me now turn it back over to President D'Annunzio.
Thank you, Superintendent Bose. So we'll start with Trustee Adams for questions for staff.
We do have some public comment.
Oh, I am so sorry. Thank you, Superintendent Bose. Do we have any public comment for this item?
Yes, we have 2 public comments. One is from Michael Herbert. Hello. I understand the district is planning on transitioning students back to school in the coming weeks, and the district plans to use temperature taking and self-reporting to protect students and teachers from the spread of disease. I implore the board to delay this transition until after a vaccine is available. Without objective protection, the board is making a negligent move that will expose children, teachers, staff, and families to unnecessary risk. The board should also consider that parents will certainly send sick kids to school and minimize what would normally be innocuous symptoms. This is a very real and serious risk that needs to be avoided. Thank you, Michael Herbert. We have a second public comment from Pernia Hassan. Dear members of the board, my name is Pernia Hassan and I am the English Department Chair and English Language Learner Teacher at Harper Junior High. I'm writing to advocate on behalf of our students who are English learners. I would like to give an overview of the enormous struggles and barriers our students face and must overcome to participate during distance learning. I cannot use more plain language than to state that their inequitable access to instruction is more than just unfair, it is immoral and unethical. We understand many of our students do not have reliable access to the internet. Some of my students rejoin the same Zoom 5 or more times in one session. They continue to join and try to attend class. Their Zoom screens freeze or lag very consistently. They may be in homes where siblings are also trying to attend classes via Zoom. Even if their internet connection is serviceable, their device may not have the capability to allow them to fully participate. Most of my English learners are using district-issued Chromebooks. There are many unfair limitations to those fortunate enough to have to use a Chromebook, unfortunate enough to have to use a Chromebook during this time. Students who have told me that they feel ashamed of their home environment and therefore will not turn their cameras on do not have the ability to turn on a virtual background. When they're trying to show their thinking, they will not be able to share a whiteboard during a breakout session. When I tried to help students learn how to share their screens during breakouts, it felt like a daunting task. In addition to many being removed from the class session entirely, sharing a screen on Chromebook is not as easy as another device. Of course, lack of previous access to technology means my students may not be as savvy as their peers who grew up in tech-rich circumstances. Just to note, teachers at our site who have children in the district and purchase Chromebooks have also noticed how much more difficult it is to use these devices. And when they move their children onto older devices, not Chromebooks, the problems do not continue. Since all students have access to Canvas, inequity persists here too. Despite an overturning of our lives during a pandemic, some teachers continue to enforce outdated student-unfriendly policies. This includes policies such as teachers not accepting late work or docking points off work turned in late. Unfortunately, the latter is even easier to enforce with a simple setting in the Canvas gradebook that easily allows teachers to dock points of any assignment turned in late. In addition, when teachers create assignments, they can set an availability range. By setting these dates and setting an end date, this is optional, students who want to view the assignment after this range will not be able to without direct intervention from the teacher. This is an easy barrier to remove. We can ask teachers to not set this date or set it for the last date of the quarter. My students continue to face injustices each day and continue to show up to their classes, try to complete assignments, and persevere. Will you not join me in setting policies that enable our students to flourish by thoughtfully considering their strengths alongside the disadvantages each may face? We need to normalize excusing work that students cannot complete. We need to remove policies such as not accepting late work. We need to end policies such as docking points for late assignments. This is the time to remove as many barriers to success as possible for all of our students. Thank you, Pernia Hassan, English teacher, Harper Junior High School. That concludes public comment.
Okay, thank you, Dr. Bose, and thank you for keeping me honest on that. I got wrapped up in the earlier Dr. Limbos conversation and just assumed we'd already done public comment, so good we have you. So moving on to Trustee Adams' comments and questions on this item.
Can I make another suggestion? I think since we talked about the school experience and learning, can we ask our students to ask questions first?
Of course, absolutely. Thank you, Trustee Adams. So I know it's a little bit of a surprise. I'll give you a moment and we'll start with you, Mr. Lee. Questions for staff about the return to campus presentation.
I don't have any questions, but I thought that what Mr. Bose was reading from a public comment was very interesting. So that there shouldn't be any points penalized for late work. I guess I kind of had two running trains of thought on that. The first being, I think it was pretty interesting that she said that people shouldn't be penalized because I feel like turning in work is a pretty important aspect of learning in school. And I think it's important for us to be held accountable for what we're turning in. But at the same time, I think that it is also important to understand the technical difficulties that some students might be having. So I think that maybe a solution might be students with technical difficulties could just let their teachers know instead of having the student accountability being removed for everybody. Yeah, that's basically it.
Okay, thank you. Thank you for that, Mr. Lee. Ms. Ortega-Nunez, questions or comments you have for staff on the presentation?
Okay, so they had an idea about putting different grades in different schools, right? Will we be around our same teachers, or will there be a difference? Because you know how Da Vinci teaches differently. We won't see different, we'll obviously be in different campuses if we go back, or depending on which groups go first. And I was wondering if we will have the same facilities that we usually have at our own schools. And also, Okay, so if we go back, will some of the curriculum change? Because right now, obviously, we are all in online friendly activities. And let's say like in science classes, will we be able to do physical activities that obviously we might be doing by ourselves instead of partners? So I was wondering if that will change or not.
Yeah, I will take that. So Mariana, what we're talking about right now are small cohorts. It's not all students coming back. So it'd be small groups of people that we identify who are struggling the most. And it is something we pondered because you don't want to undo the things that are working well. And I have that sense of familiarity. So that's why I think we're heavily leaning towards the idea, especially at secondary, but it could even be elementary, is that people stay in their distance learning classes in the morning times. And then in the afternoon time, that would be where they could have in-person support. Or if students were on campus all day, they would still be logging in to their individual classes because everybody has a slightly different schedule. But these would be small cohorts, so 16 or less, counting the teachers, so there would not be a large group. There would be some limitations to services because we would want to keep them as isolated from other cohorts as possible. But obviously, if it was something they needed for a course they were in, that we would make that available. And Da Vinci itself, because it's a completely different learning model, I don't think we were envisioning necessarily taking Da Vinci students and mixing them in a different learning model because it's not project-based learning in other classes. So that would be a consideration. But the other thing I think I just would like to reiterate is these cohorts are not all going to look the same. So a cohort with English learners in junior high could have a different model than a cohort for 11th and 12th graders at a high school, and a different cohort than you'd have at elementary. So I think what Director Perez and I really were trying to emphasize is that the only way for these cohorts to work is if we are really looking at the individual students, looking at what they need and designing the plan around them, not creating some model and then plopping students into it. So that's why we really are looking to the staff who, when you talk to staff, every teacher can name the students that they know really are having a terrible time. And so we have to collect that information, and then we have to figure out how best to serve them.
Okay, also, thank you. And I had another comment, and I think it's great for the students that need the most help to go back, because I remember when I was learning English still, and I had questions that I felt like were already answered. And if I asked to the whole entire class, it would set us back. And I could go and ask my teacher personally right there in that moment, set them aside. And I think that's really great that they could go back, because that way at least they'll be able to have their questions answered in that moment without asking the entire class. I'm feeling embarrassed or shy about it. And thank you for thinking about them.
Yep, welcome.
Thank you, Ms. Ortega-Nunez. Okay, Mr. Adams, Trustee Adams, it is now your turn.
Yeah, and I really just want to thank Adam and Mariana for those questions. I think it was good to get it out there.
Absolutely.
In terms of the focus on homeless and foster youth and English learners, would you remind us why we put the focus there? I mean, is this our decision, or is it a requirement from elsewhere?
These are the areas, foster, homeless, EL, and low socioeconomic are the LCAP unduplicated numbers. So it is certainly groups of students that the state does pay close attention to. But there are also the students that when you talk to teachers about who are the students that are struggling, these names come up frequently. So I would say it's both. And right.
So that's really, it's a kind of, that's where equity comes into focus in terms of all this.
Yes.
So one of the things that came to mind in this presentation and combined with the earlier discussion from Dr. Limbos was the issue of COVID-19 infection and reaction based upon the child's age. So as we move through these different phases, are we thinking that really in-person instruction is going to occur more readily for our younger age students, and less likely for our older adolescent students? I mean, is there should we really start thinking as we move through those phases, there's also, it's going to affect students of different ages, right?
Well, exactly. And I also think there's, that's why the state allowed waivers for only kindergarten through 6th grade, is they were recognizing potentially lower infection rate in younger kids. I think whatever we decide in the hybrid model, and I think it's all definitely being explored right now, you have to scale up. And I feel like that's really what we're doing right now, even starting with the special education assessments and then the services and then the cohort. Even just this week, we've learned different things about the processes, the screening, communicating with parents ahead of time so that they know what to expect. So we're getting better. And as we bring more people on campus, it allows us to feel like we're doing it in a safe, methodical way. If we were suddenly saying on such and such date, we're bringing back the entire district in a hybrid model, I think for staff, that would feel very overwhelming because it's just so much change. And I think people have gotten into routines with distance learning. It's working well for a lot of cases. But we know it's not working for everybody. So we need to start scaling up. And then once we do these cohorts, I think that's can definitely be something to explore, starting with the very youngest kids and then adding more grades as time goes on. And some districts around here have done that. They've started like TK2 and they wait a few weeks and then they bring back 3-4, wait a few weeks, and 5-6. So that is definitely a model. But we want to start slow because we do want to make sure that if there is any kind of illness that we can respond. Our testing, our contact tracing protocols with the nursing is working very well. And it has been working well, but we're dealing with very small numbers. So we're going to start scaling up little by little. And I think that gives confidence to staff and families.
Okay, so really, we can get the general lessons from other districts that have opened up, but as we move through it, we apply the lessons that are particular to our own Davis students.
Yes.
Right, and so that's why we can't, just like you said, decide tomorrow or in a week we're all going hybrid. That's
exactly.
I mean, even if we were in orange or yellow, right, we'd still have to be methodical about how we opened up.
Yes. Yeah. I think especially in Davis, we're a university town, people are very aware of infection rates in other university towns. And so it isn't as easy for us, I think, to say, okay, we're in orange, therefore it's safe to reopen. I think people want to see that everything's going in the right direction and will continue, even with large influx of students coming to town.
So would it be right to say we have an evidence-based reopening strategy?
Definitely.
Yeah, okay. And then just to give people to keep this in mind, I hate to repeat myself, but it's really the students who are most at risk in terms of being harmed through COVID-19 are older adolescents, right? 13 and above.
Yes.
Right. And so we're going to have to, in essence, our biggest risks are opening things for them, and our lowest risks are for our, K1, 2 students, right?
Yes.
Okay.
And then I think also you mitigate risk by really having very strict wearing face coverings, hand washing, social distancing. And I think and staying home when you're sick. Those are the 4 tenets that I've been repeating. And we have a parent training tomorrow morning where we're going to be, we'll record it so that we can put it on our website, but we'll be talking about the importance of hand washing, wearing a mask, social distancing, and not coming to school sick, because that is one of the biggest fears and worries that I hear from teachers, because in past years, people would sort of muscle through, and not just students, but staff would also come to work when they're not feeling 100%. And that is a message we really have to change, that people have to stay home when they're sick.
And my last comment then, so one silver lining in all this for adolescents, though, is that they will get the vaccine before their younger siblings. And that's probably one thing to keep in mind. So if a vaccine, if there is a vaccine, actually, it may end up that our older adolescents actually come back sooner than our younger students.
Yeah. Or at least all the adults can get the vaccine, and then they're protected in the environment.
Okay. All right. Thank you.
Thank you, Trustee Adams. Trustee Fernandez, I think you mentioned all your questions have been answered, but I just want to make sure that
Yeah, I'm good. Thank you. I appreciate the long presentation and information and discussion. Thanks.
Great. So I do have a couple of questions. So I guess my first one is, we talked about the progressive build, the likening to, we're serving the needs that are most at risk, and we're also learning how to serve ultimately all of our students. So how are we incorporating that learning into our SOPs, our standard operating practice, our protocols? If we learn something that's counterindicated to what we believed before, how's that process working so that we're kind of, we're an adaptive, evolving organization on this?
Well, I would say the number one thing that I was definitely surprised about when Samantha Webster, as I said, called all the foster youth families and the families facing housing insecurity. She was expecting, and I was expecting, that the vast majority would be ready to come back, that the home environment was not necessarily as stable, and that they would want to come back. And that is not what they heard. That is not at all. She heard that families actually, in some ways, had higher level of fears than others, and really felt that the family as a unit was safer staying home. I think Director Perez can speak as well in some of the English learner communities that have been hit much harder by this pandemic than other communities. And so families have very real concerns of infection rates and transmission. So I think that is part of the tacking that we have to do. We can't just make these plans and make these assumptions that, of course, this would be better. It's even in any group of people, there's still everybody's story is very different. And we have to have personal conversations with people and find out, this is what we're proposing. Would you want to come back? And then listen to the concerns and see if there are things we can mitigate. And so I think that has been huge. The other thing that I think we've definitely learned this week is, so part of the special education assessment protocol is the nurse will call the family the day before, run through a list of questions about whether everybody's healthy, talk to them about wearing a mask. And I think there's been a lot of worry by people that especially young children would be resistant in wearing a mask. Mm-hmm. Our nurse, Amy Stacy, who's at the preschool, did an assessment with a child, I think under the age of 3 this week. And the child wore their mask the whole time. And actually people, I've been talking to the nurses and the assessors, and they're saying that they're not getting any pushback about wearing masks. So I think one thing we're learning, that even though the state is not mandating that preschool through second grade wear masks, we're really feeling as a district that we are going to expect preschool through second grade to wear masks just like older kids. Now, of course, there'll be exceptions, and people have health concerns, and we will, of course, deal with that. But we're not just going to make this assumption that very young children can't wear a mask. I mean, we see them wearing masks out in the community, and we know one of the few things that shows any consistency in all the data is that wearing a face covering makes a difference. Mm-hmm. And so that is something that I've been talking a lot with staff who are very worried, the staff working with younger children. Would they be in a class with nobody having a mask? And so I think that's something that we're learning from not only the data, but learning from personal experience. And we're finding that families are very, very willing and appreciative in wanting these policies and practices to keep people safe. We're not hearing people being resistant at all.
Well, that's good news. And I think I suspect this goes without saying, but I'm going to say it anyway, that, you know, as we begin to serve more and more students, you know, having a process of measuring that learning and incorporating it back into our SOPs and our approach will be really important when you go to, you know, multiple students in the same classroom at a time. You're just going to learn things that, you know, that we didn't know. And we can read about what other districts do, but it's not the same. As every district is different. And, you know, we'll learn when we have, first time we've got, we start to get to the capacity of a classroom in these new rules. Oh my gosh, how do we deal with that? I just encourage us to be learning animals and document that learning. It's going to be so important. Which sort of evolves into my next question is, so what steps are we taking to prepare for expansion beyond what we talked about today to ultimately moving to larger groups? How are we sort of doing that pre-planning, recognizing there's things in the environment we don't control, outside, that we can't determine when we'll be in a place where we're safe to go back. But as we know, we hope inevitably in the not, in the foreseeable future, we'll be able to do it. What steps are we taking to prepare for the broader group of students to come back?
Yeah, I think some are very tangible. We know we want to have as close to 6 feet separation between kids in classrooms. So we've been doing a lot of walking into classrooms, have our measuring tapes out. We were looking this week into exploring, do we need to get storage so we can move out excess furniture in a classroom so that we really can space everything. So, we're doing those things. All our nurses went through the contact tracing 14-hour training that Dr. Limbos talked about. So that is something that we are actively training up everybody so that if we have an infection, people know exactly what to do. We're certainly working with our labor partners all the time, listening to what their concerns are. Matt Best and I, that we have these Q&A lists that people plop their questions in, and we are answering them as fast as we can to figure out what are the things that are keeping people up at night and what can we fix. So like you said, some of these things we have control over. We certainly have control over training, educating. We don't have as much control over what people do out in the community on the weekends, but we really can focus on the things that we are. So,
and Laura, if I can add a couple of things too, in terms of, I'll talk a little bit about facilities and then sort of the forward planning. So we also are working on touchless faucets, particularly in the elementary classrooms and the bathrooms, portable HEPA air filters where needed. And then, of course, all the installation of MERV 13 filters around the district. We commissioned all of the ventilation systems to make sure they have the proper airflow that's maintained when the units are in use. And also just thinking about planning for a potential hybrid option. We've been collecting lots of data from around the country and throughout our region and state about different model types, and really trying to work to understand where are the friction points in those models. And when we survey families and staff later this month, we really are going to be asking questions that are proxies for that have model implications. For example, Laura's statement about the amount of distance between students. If that's something that we as a district feel is really important, that has implications on the model, the format of a model. If families feel, for example, that staying with their teacher is very important, that has implications on the model. If they want to stay with their class cohort, if they want to remain at their home school, all of those things will have implications on the way we design a model for a hybrid return. And so we really want to understand those variables and how they interact with one another, so that we don't create models that, one, are just impractical or infeasible, or that create tensions that we can't resolve. And we really understand those things before we jump into the concrete creation of a model, without understanding, like Laura said, the variables that go into it, because we don't want to create a model that isn't going to work for our families, for our staff, for our community. And so those are some of the concrete steps we're doing here this month.
Yeah, thank you for sharing that. And I think I still don't think we've all fully appreciated the impact that this has and how different things are. So go back a year ago to our, early October, mid-October board meeting. We're more than 2 hours into open session, and the vast majority of it has been taken up by a discussion of this topic, which is, planning for how we're evolving to go in. And, my guess is the next X board meetings, and X is not a single digit, are going to be around this. And so I think we just all have to have an appreciation of just how much this has shifted, how we have to think about keeping our students, teachers and staff safe, but fulfilling our education mission. And I appreciate all the hard work that's going into this. But I think, I want to make sure we all recognize this, a year ago, this wasn't part of the plan. We still have to do all the other things we do, plus now we have to do this. And we have to do it extraordinarily well, because we have to keep everybody safe and we have to fulfill our mission. So I just, I guess that was a soapbox moment for that. I will not apologize. All right, I just have, I think, two more questions. The first one is, we talked with Dr. Limbos about surveillance testing and what UCD is doing. And, some of this, that what's happening in the community, in the county, in the state, and the country is out of our control, but, some things are. So, Dr. Bose, I know you've been on sort of a joint committee with the city and UCD. Any learnings from that? Any sense of how that may impact what's going to go on in our community here in Davis, and how it might impact the school district?
Yeah, it could have some very important implications. I'm part of the advisory board of the Healthy Davis Together consortium. Our public information officer, Maria Clayton, is on the communications team. And if this is something new for the community that they're hearing about, let me just give a quick refresher. Healthy Davis Together is a joint project between the City of Davis and UC Davis, with the goal to prevent the spread of COVID-19 and facilitate a coordinated and gradual return to regular city activities, and to reintegrate UC Davis students back into the Davis community. You've probably noticed over the last 3 weeks or so, all of a sudden there are many more young people walking around on bikes downtown and all around. Healthy Davis Together builds on the university's Campus Ready plan, and it's different in that it now is partnered with the city, and number of projects underway, all funded through philanthropic resources. Components will include saliva-based testing. As an example, the university has tested initially about 1,800 students on campus. And in the same way that Laura described effectively our theory of action with the beginning of our phase 2 return to campus plan, which is start with a small group of students, see how it goes with them, make adjustments along the way, and then scale success up as we start then with related services and bringing the urgent needs group of students back, English learners, foster, homeless, et cetera. The university and the city have the same theory of action. They are starting with smaller cohorts in many projects, seeing what works, what doesn't, making adjustments with plans then to expand, for example, saliva-based testing into something regularly available for city residents who wish to participate in that. They're also hiring a pretty robust team of contact tracers, along with starting to engage in a media campaign to let people know what's going on and help educate the community about how we can all participate together to minimize the spread of COVID-19. Just another example, something to get the word out about, there are free surgical masks and gloves available to anyone in the city of Davis who needs them. They're available at the Davis Police Department. And this is, as I understand, a part of the work that's happened through the start of the Healthy Davis Together plan. So, you know, in the same way we are just beginning our step 2, the Healthy Davis plan is also, you know, still in the planning phase, but also starting to launch some of these initial steps. And when we come back on November 5th, I can bring another update as part of this presentation about what's happening with that group.
Okay, thank you, Superintendent Bose. So my last question for staff is, you know, really, I know that at our next session in early November, there'll be some results from some temperature testing, sorry, no pun intended, with, you know, our staff, our teachers, our students. But any early insights from that material, the conversations we've had, the data we've collected, maybe a more succinct way of putting it is, how are we doing? How are teachers and staff feeling? How are our students, I mean, what can you share with us about how things are going?
Do you want Roddy to answer that, Dr. Bose, or?
Yeah, Roddy, if you could share some of the survey results about that.
Sure. It's a great question, President D'Annunzio, and we look forward to bringing a comprehensive analysis of that staff survey, as well as a synthesis of student focus groups to our next board meeting on November 5th, I believe, the first meeting in November. I think at a high level, some of the big takeaways are around the social emotional wellness of our staff and our students. On average, I believe our teachers were rating our student social emotional wellness in the ballpark of 70% positive, between 60 and 70%. So it sounds like that a lot of the work around the social emotional practices and norms that were established in instructional interactions have been successful, and at least teachers have been prioritizing that work. On a more concerning level, the social emotional wellness of teachers as they rated themselves is below 50%. I think it's in the neighborhood of 45% have rated their wellness as positive. So I think that's one of the biggest highlights of the survey, that teachers, you know, were being quite honest and even articulated reasons for that, including feeling isolated. Biggest concern is around uncertainty about the future, and then the expectations they have on themselves, and the expectations they have themselves for the quality of distance learning that they are providing for their students. As it applies to other categories like instructional technology, I think 97% of teachers feel confident using Zoom. In the ballpark of 70%, 75% of our teachers feel confident using Canvas. So we are developing our chops to use the technology in effective ways. But there certainly are challenges that emerge too in the use of technology. Assessment, engagement strategies, best practices. We pulled to get a sense of how teachers are spending their time, how they feel about the structures. There's a strong majority of teachers who feel positive about the structures from elementary to secondary. So that includes the quarter system and the number of minutes that we have in elementary. Again, concerns there as well. And areas teachers are interested in further professional development. So that informs what supports we're going to provide later this fall and throughout the rest of the year. When I bring this to you all at the next board meeting, we'll be able to take a look at the graphs and you'll get a sense of where our staff are. And then we also disaggregated by level, because there are some interesting differences between elementary, junior high, and high school. So for example, teachers rate their students fairly high in elementary school for social emotional wellness, but their own fairly low. And then that starts to switch as we move from junior high to high school. So there's some interesting takeaways that we can talk about there. And then from the student focus groups, I know you're able to listen and hear about some, but we will share some of the concerns from a student perspective around being away from their peers, missing the social interactions, challenges with technology, and some of the benefits that they had not anticipated that they do see now. So it's a mixed bag. Some students struggle, some students actually thrive. And we'll, like I said, I'll bring a more detailed overview next time.
Okay, thank you for sharing that. Just two reactions. I think the first is we've all been very concerned about social emotional well-being of our entire community. And so, I think the more we continue to focus on making sure that we're doing everything we possibly can, not just for our students, but for our teachers and staff in that realm. I'm glad we'll have more detailed information to kind of understand that, but I don't think we need to wait to make sure that we're investing everything there. And the second thing, I encourage us in sharing that information, to give us some guidance on, and, the so what of, okay, so what do we do? Like, so what are our options to try to address the places where we're, struggling as a community? And, for those that maybe we're not struggling, how do we double down on those and really leverage them? But thank you for sharing that preview. So there is no action required on this item. So we may move on to item 7B, which is